and sonographers are they're skipping certain steps in this protocol because one, they don't have enough time, or two, they don't have the supplies readily available to them. So
Gone are the days when we associated ultrasound just with images for expectant mothers. Now, especially with point of care ultrasound, what we're seeing is a really expanded use in areas like emergency medicine and interventional use. Here today to help us understand how important this topic of infection control is and what clinicians can do to keep their patients safe is Caroline Woodmansee. Caroline is a clinical sales specialist at Parker Laboratories. She has been in the medical device industry for more than 4 years and is actually a clinician herself. She holds a Master of Science in Occupational Therapy from the University of St. Augustine and practiced as an occupational therapist for 9 years. Caroline, thank you for being here today.
you're welcome.
So, as I said in the beginning, ultrasound use has expanded dramatically, especially with things like point of care ultrasound, especially during the pandemic, for example. Hospitals really started to ramp up the use of point of care ultrasound for the sake of diagnosing COVID patients or just doing follow up. And obviously, that brings a lot of infection control implications. And it really is a beneficial tool in various areas. It's safe, it doesn't emit radiation, for example, but that doesn't change the fact that the ultrasound probes themselves can become a source of infection, transmission, if they're not properly reprocessed. Studies, for example, have shown that gels can harbor harmful microorganisms, and the same is true for the probe, especially when it comes into contact with non intact skin and, in some cases, with blood and other bodily fluids. For example, I wanted to note that in 2012, there was a patient death reported from an improperly reprocessed TE probe, and it was because the patient contracted a hepatitis B infection during the intervention. So, really, it is an important topic, especially as the use expands. And in places like OBGYN offices, endocavity ultrasound is used a whole lot. And obviously, that's a semi-critical, sometimes critical procedures in those places. So all of that being said, could you tell us like what are some common mistakes that can contribute to the spread of infections during ultrasound exams or procedures?
Yeah, I think a lot of times it's lack of compliance to infection control protocols. And this can be due to a multitude of factors. I think one is lack of education. So protocols maybe be in place, but the clinician might not know what it is. They might not know how to implement these steps.
Right.
So they need to be educated, have that knowledge, know how to implement that protocol. And then I think sometimes there are protocols in place, but clinicians don't have the time to really go through it. So they're skipping these steps, and they're seeing a high volume of patients. They're expected to perform in a smaller window of time.
Mhm.
And so they're not following the protocols, or they're following them loosely in order to kind of keep up with that time constraint. So I've seen this personally in the last year, in the vascular access world.
Mm.
So I don't know how much you know about ultrasound guided peripheral IV insertions, but I've learned a lot in the last
Mm.
year, kind of training on one of our new products. But evidence shows that an aseptic non-touch technique is safest for the patient. But what I've seen going out there doing training, a lot of times nurses and sonographers are they're skipping certain steps in this protocol because one, they don't have enough time, or two, they don't have the supplies readily available to them. So they're just like, oh, I'm gonna skip putting that barrier over that transducer and go ahead and do the insertion. Well, that's putting your patient at risk of infection befriended him. So just know that if you skip these steps, you are putting your patient at risk. And I
Yeah.
do think that um, at least all the clinicians I've worked with, not one of them would ever intentionally, put their patient at risk.
Yeah.
I don't think they're realizing that skipping these steps, not properly cleaning and disinfecting the ultrasound probe, or not putting a barrier in between the probe and the insertion site, they don't realize the level of risk they're putting their patient in.
Yeah, sometimes it really is a lack of awareness and a lack of time. I think clinicians, of course, like you said, they want to keep patients safe. That's why it's so important to create that awareness, to create those protocols, and to actually ensure compliance. Sometimes you have facilities that where the clinician really, like you said, they don't have the proper equipment or the proper barrier. Sometimes they're given a barrier that isn't even supposed to be used with a probe. Not to mention that that'll maybe damage the probe itself, or just damage image quality. But they'll use things that really aren't even approved. Sometimes for endocavity probes, something we've seen is they'll use a condom instead of a probe cover, and that's just not approved. There's a product for that, right? Sterile or non-sterile, but the point is it's made for the probe. It's approved by the ultrasound manufacturer, and that's just so important. Though your point on awareness, going off that, in 2018 there was an interesting survey that was done by the World Federation for Ultrasound in Medicine and Biology, where they performed a survey on over 1,000 ultrasound users from 60 countries. So it's pretty diverse, and only 60% of the respondents said that their department had infection control guidelines in place specifically for ultrasound machines and transducers. Now, we know that there are things like the Spalding classification, which are very useful, when we say, okay, it's critical, it's semi-critical, or it's non-critical, to know how much we disinfect. Do we use a probe cover, et cetera? And there's people have proposed simplified Spalding, just critical and non-critical. But what are some key steps in addition to that practitioners can take to mitigate those infection control risks in their ultrasound practice?
Yeah, I would say if you do have a protocol in your practice, educate yourself on it.
Mm,
Ask questions, make sure you know how to perform that without flaw. But if you don't have a protocol, which from what you said, that 60% is a really high
yeah,
number.
too
If you
high.
don't, yeah, way too
Yeah,
high.
yeah,
That's kind of alarming. If you don't have a protocol set in place, work with your department, or if you have an infection prevention team, work with them to develop a protocol that's going to help protect your patient, and it's also going to be conducive to your workflow. So um, if you have a protocol that's going to set your team up for failure to begin with, you need to look into developing something else. And like you mentioned before, it's important to know when sterile gel is needed, know the levels of disinfection. Obviously for general ultrasound on intact skin, you need to use low level disinfection, whereas these semi-critical devices like endocavity probes, you do need high level disinfection. So know your level of disinfection and what the procedure requires. And then I think, you know, if you increase standardization, then you're going to increase compliance. So have an infection prevention and control protocol that your clinicians are going to follow. Um, like I mentioned before, a lot of these protocols, they're there, but they're not being followed because of the time constraint, lack of
yeah.
availability of supplies. So don't set your team up for failure. Go back to the drawing board, work together, develop a protocol that's going to allow for that standardization so you can kind of maintain compliance of that.
Yeah, so important really for facilities to work with the other teams that are available to them, especially in hospitals, like you mentioned, the infection prevention team, just to make sure that they create that culture of infection control and not leave ultrasound out. I think that unfortunately that's too common. Like you said, it's an alarming statistic. But they didn't say it didn't necessarily have infection control guidelines in general. It was just for ultrasound, which is worrisome, right? If it's for
Yeah.
everything else, but then ultrasound, it's like, well, we don't have to worry about it too much. It can be a vector of infections. So we talked a little bit about how it's gone to new clinical areas like emergency medicine. So I think that really raises the question of whether we need to develop new ways to combat disease transmission. You kind of already talked about how in some cases you use a low level disinfectant, but in other cases you really do need a high level disinfectant. And in that same survey from the World Federation for Ultrasound, there were some interesting statistics related to the concerns that the respondents had. So 17% said that the infection control products were too expensive, so disinfectants. 15% said that the disinfection methods lacked effectiveness, and 32% found the cleaning process too time consuming. So sometimes these facilities do have a lack of time. The caseload is high, um, and clinicians might just view, or even managers or admins might just view this whole process, one, as maybe it's not that necessary, and two, how long is it going to take to reprocess every probe? So, are there any emerging technologies or innovations in an ultrasound infection control that practitioners should be aware of that really tackle these concerns? Because, of course, we do have to, I think, really advance in what we're able to offer the clinicians if we're going to also create awareness, right?
Yeah, I'd say do your research. There's other products out there. It's a common misconception with high level disinfection that you need one capital equipment, which
Mm,
is a lot of investment up front, that you need a designated area. And
yeah.
some of these high level disinfection processes do require that, but not all. And then, it's commonly thought that you need an extended period of time to go through a high level disinfection cycle. So,
Mm,
um, there's others out there that they're fast, they're practical, they can be delivered at point of care, and it's going to allow you to go from patient to patient with an easier transition. And then another thing that I haven't mentioned yet, a lot of times there are harsh chemicals that are being used during high level disinfection.
mm,
So these probes and cords are getting damaged. So your investment over time is getting damaged.
yeah.
I've even had in the last couple of months a couple of facilities tell me they have brand new ultrasound equipment that they're not even using because they're so worried about their equipment being damaged when they go through the high level disinfection process. So we are actually manufacturing two products, Tristel Duo, an intermediate level disinfectant, and Tristel Alt, a high level disinfectant. So Tristel Duo is going to be great for that vascular access realm that I spoke of a few minutes ago. So in between procedures, Trisol Duo can be transported from patient to patient. It
Mm,
gives you that easy transition from procedure to procedure. And then it also can be used in biopsies, which I've talked to a lot of facilities who they're performing so many biopsies a day, they don't have time to, transport them to
yeah.
other parts of the hospital or other parts of the clinic. They're able to perform that disinfection at point of care with Trisol Duo. And then we have Trisol Alt, which is a high level disinfectant. So you can run through an entire high level disinfection cycle in 2 minutes. And again,
Wow.
just like
Yeah.
Trisol Duo, it's a chlorine dioxide foam. So 4 pumps of the foam, 2 minute kill time, and then you're ready to go. You're ready to transition from patient to patient. And then another thing that it's not going to do, it doesn't have this harsh chemical makeup. It's a chlorine dioxide foam. So the way chlorine dioxide works, it targets the microorganisms and isn't going to damage the materials of your expensive ultrasound probes.
That's so important, right? To take care of the machine, but the time is really impressive. I think facilities will find that to be a really impressive thing because, like you said, the problem sometimes is you're trying to go from procedure to procedure. You sometimes just don't have time to go to another room, so it's
Right.
mobile.
Right. So this is solving that time constraint problem. It's, the 2-minute disinfection cycle, and it's portable. So
Yeah,
there'll be no excuse for
yeah,
clinicians to not follow that protocol going from patient to
right.
patient.
Right. Oh, that's really great. I mean, that for sure is the type of innovation I think that we need, coupled with the awareness. I think that that could really help us combat those infections, especially in the hospital setting and in those interventional settings where too often there's just not the time to do it. This will definitely help, and it's effective. So I think it answers a concern of some of those respondents in the survey who they're probably just a little bit frustrated with how to know what to use. I think it makes it clear.
Yeah, absolutely. And I would say, if you're a hospital or a clinic that is thinking about changing a protocol up or switching to another product, a lot of times, hospitals will shy away from wanting to change things up just because it takes some time and effort initially to make some changes, but in the long run, it's going to be worth it. If it's going to protect your devices, if it's going to make it easier for your clinicians, and if it's going to increase safety for your patients, it's going to be worth it.
Exactly, exactly. I mean, it's the return first and foremost is in the patient safety, right?
Right.
Patients being safer, and then there's a financial return as well in protecting the equipment and longevity of the equipment. I mean, no facility wants to find themselves in the situation of the one you mentioned where they don't want to use their machines because they don't want to damage them with high level disinfection. So I think this
Yeah.
provides a better route for them. Well, thank you so much again, Caroline. I mean, I hope that this discussion serves as a resource for ultrasound users, especially the ones that are really concerned trying to navigate infection control and admins in places where ultrasound's use is expanding. I think this will definitely be something that they can listen to and get more guidance. So thank you.
Thank you. I appreciate you having me on here.